Hello everyone, and welcome to the Immigrant Workers Using Drawings to Convey Health and Safety Messages with Drs. Janet Parsons and Lynn Holness. We also have joining us Karen Jacobs from the Work Journal, which we're very excited to have her as a co-moderator today. This webinar is part of our Effective Workplaces webinar series, and we're glad to have you today. My name is Tanya Hyde, and I'll be managing the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability, and this webinar is made possible through the support of the Community Grants Program through the BC government, as well as through donations and memberships to our organization. We'd also like to thank Work, a journal for prevention, assessment, and rehabilitation, for releasing the research article associated with this webinar for open access for everyone to access. We really love working with Work Journal on these webinars. As I mentioned, my name is Tanya, and I'll be managing the technical aspects of this webinar. And Karen Jacobs is also on the line. She's the editor-in-chief of the Work Journal, and she'll be moderating and handling the Q&A session. And our speakers today are Janet Parsons and Lynn Holness. So I'll hand it over to Karen to tell you a little bit about the Work Journal, as well as to introduce our speakers today.
Thank you, Tonya, and it's our privilege and honor to be with you today and to have this wonderful relationship with the Canadian Institute for the Relief of Pain and Disability. The Work Journal started in 1990. We're 27 years old. We are an interprofessional journal that looks at the construct of work, and so we're very happy to be able to be a collaborator and to make the journal article that you're going to hear about today open access. Work also has a Learn at Work webinar series. We have a YouTube channel, and I direct you to think about subscribing and listening to even more webinars related to the construct of work. So thank you again for being with us. Let me introduce our speakers, who I'm sure you will thoroughly enjoy getting to listen to. Janet is a research scientist at the Applied Health Research Center. She is at St. Michael's Hospital, an assistant professor in the Department of Physical Therapy and the Institute of Rehabilitation Sciences, as well as an academic fellow in the area of public health at the University of Toronto. She has a program of research specializing in the development and application of qualitative narratives and arts-based methods, which she uses to address a wide range of healthcare topics, including work and health. She is a health service researcher with a particular interest in health equity. Lynn is the director of the Division of Occupational Medicine, the Department of Medicine, as well as a professor also in public health at the University of Toronto. She's the division director for occupational medicine at St. Michael's Hospital and the director of the Center for Research Expertise in Occupational Disease. Her research interests in occupational health are broad, covering a variety of topics including occupational disease and its identification, occupational health services, occupational health and safety in the context of specific populations, such as vulnerable workers. So I'm going to turn it over to our speakers, Janet and Lynn. We are delighted that you're here today, and we look forward to listening to your webinar. Welcome.
Thanks so much, Karen. Thanks for that great introduction, and we feel very honored to have been asked to do this webinar, and we're really happy to be able to spend this hour with you on the line, and hopefully you'll find our presentation enlightening in some way. So without further ado, just to let you know, I'm going to speak for about the first half, and Lynn's going to speak for the second half. We'll start to the first slide that says overview. And I always think when we start a presentation, it's always nice to know where you're going and what you're going to hear. So just a quick overview of what we'll cover today. I'm going to just quickly review the learning objectives, and then I'm going to go on and talk about an introduction, give people an introduction to the field of arts-based health research. And then we'll move on to talk specifically about the topic today, and in particular our pilot study, which is the focus of the article and work, which is related to the experiences of immigrant workers. And I'll also tell you a bit about our team. We had a very interesting multidisciplinary team that collaborated together on this project, and so this is the work of a group of people, and we wanted a very eclectic interdisciplinary crowd. So we'll talk to you a little bit about some background to the study, the provincial context for the study here in Ontario, the goals of our pilot project, and then I'll finish up talking about the methods, and then Lynn will proceed to talk about the aspect of working with our community partners for this project, incorporating an artist into the study team, which was a really exciting part of this project, and then Lynn will go on to review the key findings of the study, and we'll have some concluding remarks after that. So without further ado, the other thing I wanted to mention just before we continue with the Janet Brown is also listed on the slide. She has contributed to these slides. She's sorry she was unable to be with us today, unfortunately, because of illness, but we wanted to acknowledge that she is also a co-author on the presentation as well. So in terms of learning objectives, today what we're hoping that you'll have an opportunity to learn about the growing use of arts-based research and knowledge translation approaches to healthcare, as well as exploring the experiences of workers newly immigrated to Canada with respect to occupational health and safety messaging. And we want to share with you our experience as a team incorporating drawing into the research process. So just a few words to let you know a bit more about the whole field of arts-based health research. So this is a burgeoning area, a burgeoning set of methodologies within the qualitative interpretive tradition of inquiry. So I'm a qualitative researcher, a number of people on the team are qualitative researchers, and we have an interest and expertise in leveraging the arts in the research process. The arts constitute a different way of knowing. They bring not only a cognitive component to research, but also bring an emotional or affective component to both healthcare and health research. The definition of arts-based health research is really the use of the arts, any use of the arts for generating or disseminating knowledge in healthcare. And it can be quite broad in terms of the range of genres that are brought to bear in the process of knowledge production or knowledge translation. So for example, there are different arts-based projects that have used film, photography, drama, poetry, dance, and so forth. So importantly, in terms of knowledge translation, the arts offer different alternative ways for communicating research findings and best practices. Well, today's talk is going to focus specifically on visual methods and drawing in particular. But there are various genres of visual methods, various genres that I've used personally in my research, including photography, film, drawing, and painting. Other researchers have used mixed media and collage. So there's multiple ways in which visual methods can be used. And why might we want to use visual methods? Why might we want to use visual depictions? Well, all of these visual research methods genres have in common that images, as opposed to text, are very prominent or feature prominently. Images are powerful, and they can often make message stickier. So they help us remember key messages really well, which is one of the reasons why we thought incorporating drawing into this project might be a really fruitful way of communicating with immigrant workers. Stewart says that images can be tools, quote, for the discovery of self and others. And images present opportunities for representing experiences in accessible and familiar formats to a range of audiences. So there's a democratizing impulse here in that images can sometimes help act as a leveling device when people have differences in terms of language, educational levels, different areas of expertise, for example. So I'm going to go on and talk about our pilot study, which employed arts-based qualitative research methods. And as Karen mentioned, it was published in Work. We were thrilled to have it published there. And the title of our paper was Rights, Responsibilities, and Representation, using drawings to convey health and safety messages among immigrant workers. And we wanted to, at the outset, to acknowledge that the study was funded by the Ontario Ministry of Labour through a grant from the Centre for Research Expertise in Occupational Disease. Our team, I mentioned before, is a fairly eclectic group. So there's Lynn and myself, but there were other critical members of this team. So Chris McKillop, who unfortunately was not able to be with us, Dr. Chris McKillop is a PhD-trained qualitative researcher. She has specific expertise in incorporating drawing into the research that she does, and she was very instrumental to this project. She was intimately involved in the research design, qualitative data collection, data analysis, and the write-up of the paper. And she was very much an integral part of our team. Janet Brown is here at St. Michael's Hospital, and she was very involved in terms of working with Lynn and others to develop the community partnership with the community health centers, health center that was the site for the study. And Susan Scott is a visual artist who was, again, an integral member of the team and was part of the study right from the beginning in terms of the design. She participated and attended the interviews and focus group and produced all the artwork that you're going to see today. And Hal Dallaire works at the Community Health Center and was integral. He was one of our community, he was at the community organization where this research took place, and he was integral to helping with recruitment, study design, and so forth, and was just a great person to work with. The expertise that we cover included occupational health and safety, expertise in research for work and health, qualitative research methods and arts-based methodologies, community, the ability to foster and sustain community partnerships, fine arts, drawing, the humanities, as well as community-based participatory research. So just to set the stage for as a little bit of background for the paper and for the study that we did, it will probably be of no surprise to anyone here that there's a considerable burden associated with workplace injury generally. It's a relatively common occurrence worldwide. It is estimated that on any given day there are close to 1 million workers who are experiencing a work-related illness or injury. In 2005, almost 1 million Canadians experienced a non-fatal occupational injury. So this is the workplace injury in and of itself is important. Not only are the costs economic, but also social and personal, and these are associated with these injuries, and these costs are significant. And we were particularly interested in working with immigrant workers because they constitute a very vulnerable population for a whole host of factors, which include precarious employment, language barriers, a lack of recognition of their credentials and educational backgrounds, issues of race and ethnicity, social class, documentation status, and so forth. And it's also a topic that is fairly under-researched. There are relatively few studies that elicit the perspectives of immigrant workers regarding workplace hazards and occupational health and safety. Well, just to set the context for our study, this study took place in Ontario, in a suburban community of Toronto, and Ontario is a popular settlement location for recent immigrants, and the community in which the study was based was likewise. In terms of the legislative environment in which this study took place, the Ontario Occupational Health and Safety Act is based on the premise of the internal responsibility system, whereby responsibility is shared among workplace parties for health and safety, and workers' rights to information and participation are safeguarded. Current practices of messaging regarding occupational health and safety by the Ministry of Labour in Ontario were introduced, were highlighted by a new awareness poster in 2012. It was new in 2012, which was called Health and Safety at Work. We're going to come back to this poster a number of times throughout the presentation, but just what's up on your slide now, and this is also in the paper, you'll be able to see this is what the original Ministry of Labor poster looked like. It was meant to be conveying messages to a broad range of workers, not specifically immigrant workers, but you can imagine that this is very text-heavy format, that it might not be as accessible to immigrant workers. And in the course of our project, we asked participants to offer their impressions of this poster as well as image-rich posters. So just to step back about the goals of our pilot study, our primary goal was to address a gap between policymakers' efforts to make occupational health and safety messages accessible to new immigrant workers and workers' understanding of those messages. But we also had a secondary goal. Obviously, there are people like myself who are methodologists on the team, wanted to assess the feasibility of using qualitative arts-based health research methods to explore visual approaches to making occupational health and safety messages more understandable to new immigrant workers. So now I'm going to go on and review the methods. So our study design was a two-phase pilot study. So the first phase entailed in-depth interviews exploring participants' lived experiences of work and health and safety training since coming to Canada, as well as in their countries of origin. And then for the second phase, participants were invited back for a focus group discussion in order for us to explore the themes that had emerged in phase one in more depth. And as part of both phases, arts-based approaches as well as the images produced by Susan Scott were a focus for discussion as well. In terms of our participants, we recognize the role of culture and language differences might play in the experiences of our participants. So for this pilot, instead of taking a broad brushstroke and looking at people from many different backgrounds and immigrating from many different parts of the world, we focused on people who were newly immigrated from the South Asian countries. And so specifically, people had to be new immigrant workers, and they had to be of South Asian descent. Another one of our inclusion criteria was that they be able to at least speak and understand English for the pilot, because this was because of feasibility issues, because qualitative research is very much based in language, and for us as a team, in order to be able to do analysis, we didn't have the capacity or the funding to translate interviews. But we recognize that this was a pilot, and we're not saying that this is ideal, and we think that in future studies it would be wonderful with sufficient funding and time to be able to bring in people who might not be English speakers. In terms of our data collection strategy, as I said, in-depth interviews were conducted in phase one. The interviews not only explored participants' lived experiences of work and health and safety training since coming to Canada and in their countries of origin, but they were also invited to discuss their impressions of the text-based original poster that you've already seen, and some images that the artist had devised in advance to reflect the content of the original poster from her perspective, and they offered their input as to how the images could be used or improved. Participants were then invited back for a focus group discussion to comment on the revisions that the artist had made based on their feedback, and to explore themes emerging from phase one in greater depth. The artist was present during the interviews as well as the focus group, and throughout she took visual notes and used this to translate their feedback visually, and then she also used this to graphically represent the research process, and we'll show you a bit of that when Lynn goes on to talk about the results. And finally, in terms of data analysis, in keeping with qualitative methodology, data collection and data analysis occurred together in an iterative process, and we used an inductive approach using a qualitative content analytic technique, which draws on grounded theory methodology. This is a participant-centered style of analysis where coding and themes are developed from the participants' accounts. And we used a constant comparison technique to look for differences and similarities both within interviews and across interviews. In addition to this, the artist took notes and made drawings during the interviews and focus groups and used this to produce a graphical representation of the research process. I'm now going to turn things over to Lynn.
Thanks, Janet. So I'm just going to give a little background around the community partnerships that underpin this study. So the Research Center, the Center for Research Expertise in Occupational Disease, was a competitive grant, which was initially from the Workplace Safety and Insurance Board in Ontario, which is the provincial compensation system. The center was founded in 2004, and in some legislative changes, funding has now moved to the Ontario Ministry of Labour. And the Research Center, so part of the requirements for the Research Center was a lot of collaboration and partnership, and in fact it's one of the 4 key principles, and it is something that the center actually reports on and is measured on. The center has an advisory committee which really represents the broad health and safety system, so it includes representatives from the government agencies, the Ministry of Labour and Workers' Compensation Board. It also includes representatives from the Health and Safety Associations. These are associations funded by the Ministry of Labour. Actually, those supported from employer premiums paid to the Workplace Safety and Insurance Board, and they provide prevention services to industry in the province. Also on the advisory committee are worker representatives, primarily labor representatives, and employers. So the center itself has this advisory committee, which are actively involved in creating our research agenda, but also really substantially enable partnerships for research collaborations. What it has meant for those of us who work in the center is we've moved very much from a researcher-driven approach to research, where if it was something that I was interested in, I would kind of do that project, to a research agenda and projects which are much more informed by, as I say, our advisory committee and the system more broadly. They're meant to be relevant and practical as far as the system is concerned, and also specific to the context. So that is the Research Center. But there's another piece of this which was also important in this particular project. There was a period of time in the 2000s when the WSIB actually sponsored an occupational health services network, and its focus was on bringing together a number of players from the healthcare system, particularly from community health centers. And the network, first of all, allowed the group to meet and come together and discuss common issues around workplace health. In particular, the challenges of knowing about their clients' work and its potential effect on their health. But it also funded a number of seed projects in community health centers across the province. And this has actually enabled some of this future work to be done, because those relationships were built and have been fairly easy to maintain. The network no longer exists, but as I say, the relationships that were established continue, and it has allowed us to do a number of projects with a variety of different community health centers, several of which who were involved in that original network. And the community health center where this work was done was in fact one of those original participants. So that's kind of the background around the community partnerships. The other piece of background which I think is important is the visual artist Susan Scott. And in fact, this was not the first time our research center had worked with Susan Scott. We did a project a number of years ago that was focused on the under-recognition and under-reporting of occupational disease. And this involved focus groups with a number of groups within the system, so workers, employers, labor and worker representatives, and healthcare providers. And we actually had 2 artists. Susan Scott's a visual artist. We also had actually a writer. And in this project, they again attended all the focus groups and team meetings. And each of them came up with their visual interpretation of the focus groups and the team discussions. In Susan Scott's case, she actually created a snakes and ladders game, which she felt represented what she was hearing about the challenges of recognizing that you might have a work-related problem, the challenges of reporting it, and going through the claims process at the compensation board. So that was our first experience with Susan, as I say, interpreting the conversations into a visual form. As I say, we also had a writer involved who wrote a very interesting story, again, listening to the participants' description of their experiences. She created a story of an injured worker which described their, again, process through the system. She, again, illustrated that, and we have actually used that in medical student teaching at the University of Toronto. So that was our first real experience with using visual arts in a research project, and as I say, it was the first time Susan had been involved in a research project with us. So now on to the results. So the initial set of interviews were with 7 participants, 4 females and 3 males. They ranged in age from 30 to just over 50. 6 of them had had Canadian work experience and 1 was looking for work, and 5 were actually working at the time of the interview. So as far as their experience from a health and safety perspective, so again, although they had not been in Canada for very long, 3 of them had already reported to us they had had a workplace injury or had developed a workplace disease. And then we focused on their health and safety training. And they felt that training in general had been fairly easy to understand. Generally, they had been asked to do online training, so they went onto a computer and worked through an online training session. As I say, they said it was fairly easy to understand, but they felt it was very minimal. And they also noted that employers didn't actually check to make sure they really understood the training. So although they had, in a sense, complied with the legislative requirement to receive training, they've conveyed the sense that, as I say, it was basically being done to meet those legislative requirements. So one of the quotes, my previous job, although there was that training on the computer system that you go through, I mean, you just went through it because you had to finish the module to show, yes, you had finished the module. But there was no checks and balances, basically. We then probed a bit about, again, their health and safety experience from the sense of what were their concerns around health and safety in the workplace. What might lead them to not report issues or concerns they had? What might lead them to not report actual injuries that they had experienced? And a lot of the barriers really centered around their fear of losing their job. They, again, from some of the training, knew that they should be able to report issues without repercussions. They expressed a lot of concerns about who they could really trust in the workplace. And it was interesting because it was trust not just, say, with the employer or the supervisor, but also concerns around coworkers. And again, could they trust them to let them know that they were concerned about a particular hazard? And some of them have had experience where they had shared that information with a coworker, and there had been some repercussions. So the concern about who can I trust to share this information was certainly came through strongly. The other thing is, because they were often entry-level jobs and low-paying jobs, they felt that they were easily replaced. So if they had reported something or raised an issue, although they shouldn't, in fact, have any repercussions from the employer, their sense was that that might happen, and because there were a lot of others that would be very happy to have their particular job, that was another motivation for them not reporting things. And equally, once they had the job, there was a lot of pressure to maintain the job to support their family, because often if they were newly arrived, they might have been the only one in the family that had a job, so basically support for the entire family was resting with them. In talking with them about what might enable them to feel more empowered to report issues, one of the things which was very interesting was their sense of the burden of fear should shift from the worker to the employer. So as they were experiencing it, they very much felt that they were the ones that would get punished if they reported something because the employer might terminate them. that they saw the alternate possibility that if the Ministry of Labor, through its inspectors and through legislative requirements, if the ministry actually strongly enforced the legislation, then the employer would actually be afraid of not complying with the legislation. So it was a very interesting notion of shifting the fear from them being fearful to the employer being fearful. And they also talked about kind of that it would be helpful if there was a positive collaborative attitude within the workplace, that would help them feel more secure in reporting issues. We talked, and they talked about their challenges in working as new immigrants. They clearly talked a lot about the challenges of securing employment. Many had been professionals in their country of origin and found it extremely difficult, if not impossible, to get a job in their same profession, or even that might use a similar skill set. And they also talked about what they called their catch-22. Jobs typically said you need Canadian experience, but they couldn't get a job to get that experience because it needed Canadian experience. They also talked about self-esteem issues, the negative consequences of not securing employment in the same profession, feeling useless, and it also exacerbated their fear of losing a job once they had actually found one. So moving on to the conversation about the various posters, we first chatted with them about the Ministry of Labor poster. This is an awareness poster which is required by law to be posted in the workplace, and as Janice noted, was introduced in 2012. So their comments about that poster was that it clearly conveyed the rights and responsibilities of the worker and the employer. They said it was understandable, but they also thought it was rather wordy and legalistic. And again, as we probed their sense of its use in the workplace, their sense was the law required that the employer have the poster posted. So that requirement was being met, but they didn't necessarily feel that the employer would actually follow what was on the poster, specifically around reassurance that workers are protected and that they could raise health and safety concerns and not be penalized for doing that. The other thing they noted was that the poster was very non-specific. So although it talked about general rights and responsibilities and duties, it didn't provide any specific direction to their particular context. As Janet said, Susan Scott had actually done some previous work for this community health center. She had connected with them through the occupational health services network, and they had actually, because they were very interested in workplace health and were concerned about their immigrant clients, had already done some work with her in creating some visual images. And they included several parts. So first of all, one which they called the workplace exchange, which was in a sense trying to outline and convey that both employers and workers have responsibilities in the workplace. So the employer clearly provided wages and benefits to the workers, but they were also responsible for providing safe and healthy workplaces and for worker training. Workers have responsibilities to do the work that they were hired to do and to follow safety rules and report safety issues. So as I say, that was one of the images which was created for the Community Health Center. And then there were a series of images which, again, moved forward with that dyad sense. What must the employer do? What should the workers do? And we've just put a few examples in the slide. So this first one is around the employer has to provide safety training. The workers, on the other hand, have a responsibility to follow safety procedures and policies that are in place. And another one around hazard identification. Employers have to clearly identify hazards. Workers must know and obey hazard warnings. So there was a whole series of these dyads which Susan had drawn for the Community Health Center and that they were using in visual materials in their clinical context. So for this project, a poster was put together which included that workplace exchange component, and then a number of the dyad visuals around a number of core health and safety principles and practices in the workplace. So this is the image that we then asked the workers about. So the workers reported on seeing the images that they understood the notion of the workplace exchange, the notion that both employers and workers have responsibilities. It was interesting that their interpretation of that varied a bit. They found the dyad images very easy to understand. They said even without the text, and they actually suggested some additional dyads. So one of the workers talked about the challenge of stress in the workplace and thought a dyad to visualize the idea of kind of the employer's responsibilities in trying to reduce stress, and the worker's response would be an important addition to that series of visuals. The artist revised the Workplace Exchange dyad poster, and they also created, Susan also created a very interesting poster which was a summary of the project. So it actually includes really the whole process in visuals, the individuals being interviewed, how the data was collected and a bit about it, the emerging results, and then the conclusions, which basically were that although the Ministry of Labor poster was understandable, they felt that having visuals was much more helpful in conveying the information. So the focus group was really looked at the revised overall images and also this summary poster and asked the participants what they thought about them. They were fine with the revised Workplace Exchange Dyads poster, and they also reported very positively around this poster as a summary of the project. They felt it was very easy to stand the process that they had experienced. They felt it captured very well the issues that they had identified, such as barriers to prevention, the fact that they were looking at the posters and providing comments about the posters, and then the actual conclusion that I see it, I get it. So that was the second in the focus group component of the study. So just in summary, we feel there are many contexts for application of using these visual methods, that they're very useful tools for primary research and also for knowledge translation and engaging stakeholders. They're accessible and that they convey complex ideas and really a wealth of data in a very succinct way that is generally easy for a wide audience to understand. So just before we turn it over to Karen to invite questions, and we thought rather than us have the discussion, it would be much more beneficial for the audience to pose some questions or provide comments. So we want to acknowledge the study participants who spent several hours, the community partners, the Ministry of Labor, which funds the Research Center, and clearly our co-authors and broader set of community partners who supported the study. So Karen, I'll turn it over to you, and we look forward to, as I say, comments and questions and some discussion.
Thank you so much for this very, very interesting presentation. You know, I have read your article before, but even listening to it, it was really more insightful. I don't see any questions posted yet, so I'm going to just frame a couple of questions to you. If you had no issues with funding, like that was not anything you had to worry about, what would be your next steps? What would you do?
So Janet will answer probably from a more research perspective, as she's the research-based researcher. But we actually have, although we don't have a lot of funding, we have actually continued to utilize Susan's services for knowledge translation. So my core research focuses on workers with occupational skin disease, starting from the prevention that happens or doesn't happen in the workplace, through their initial symptoms, their usually very long and I'm going to say tortuous journey through the healthcare system to come to a diagnosis of the work-relatedness of their problem. They then travel the compensation system, and we've also done a lot of work around return to work and outcomes. So Susan has created, which to me, an amazing roadmap of that process that starts in the workplace, uses visuals quite similar in some respects to some of the Dyad images, but then in a very evocative way, as I say, demonstrates kind of the healthcare challenges, some of the challenges that some workers experience in the compensation system, and then basically the three roads to whether it's a very good outcome with return to work, a kind of in-between outcome where there is return not necessarily to their original job, and then the unfortunate outcome for a small percentage where they never get back to work and continue to have significant impairment, and their quality of life is affected. So, as I say, more from a knowledge translation perspective, Susan has done some really interesting work, and we are actually about to use that. We're interested in whether it will be useful as we actually, so we're looking much more at patient engagement. So in our clinic where we're seeing workers with potential work-related problems, we're actually, hopefully in the next few months, going to start to use that roadmap she's created as basically a visual cue as we take the patient's history to help bring out some of those very important aspects and allow them to express their feelings, often of consternation as they move through the system. So that's some of the ways, and it would be lovely if we could do a lot more of that if we had unlimited funding. And now I'll let Janet respond from a research perspective.
So from my perspective, and it's very exciting to hear what Lynn would do, because we both come at it with, it's wonderful to work together because we come at it from different perspectives. And so I guess I'm so interested in, as a methodologist too, to sort of see, well, this was done with a particular group who spoke English with a particular cultural, sort of set of cultural backgrounds that they came from. And I think it would be fantastic to do some of this work, but in comparisons with different communities, and different communities where there are different mixtures of people who come from different parts of the world, and do some comparing and contrasting of how different communities actually take up images, what they see in it, and what they would recommend, and then be able to start to understand how do we, especially in a city like Toronto where we're based, where there are people from so many different cultural backgrounds and so many people coming every month to the city of Toronto, how could we tailor tools to help particular groups? How could we find things that were commonly helpful to people, and how could we also tailor messages based on particularly vulnerable groups? And I think also the opportunity to look at different genres, for example, would be fantastic as well. So if you did something that was image-based, but what if you did a short film with actors whereby they acted out a scenario, and then you compared sort of how people look at images, which need to be posted, but maybe other kinds of online learning tools that could be incorporated into the tools that workers say that they're already being asked to use by their employers, but that might resonate more and might help them take the messages away, and then also working with employers, right, to sort of get their perspective about sort of where they see their responsibility, and maybe even ask them. The one other thing I would think would be fantastic would be, it's amazing when you ask people, I've done other research with other groups before, where we actually ask them to produce artwork that reflects their experiences, and I think that would be another whole other facet of this, where we could ask groups to produce some of their own artworks, because they often have an extraordinarily rich understanding of their own experiences, and then when they put it into an artistic format, it's just that much more powerful. So if you can combine their own artwork with their stories, it's an extremely powerful medium for knowledge translation and for educating healthcare providers and employers and other people in the system, including policymakers.
That's fantastic. I can just envision this. It's wonderful. We always wish to have some unlimited funds. So maybe somebody who, maybe someone who listens to this webinar will be inspired. So another question I want to ask is, and I love this one. I've actually used it at doctoral defenses. A headline. If you could pick a headline out that would go into the newspaper or even on the 6 o'clock news about what you're doing, what would that be? And what is the messaging you want to get across? Aren't you glad this isn't your doctoral defense?
Oh, yeah. I'm so glad. Phew.
So I don't have a headline. But to me, there's something important, and it actually is also caught up, as I described, the research center and moving from the kind of investigator-driven research to that being more informed. So when government or kind of scientists, when they're still probably very idealistic, tend to be very regimented about how you do things. From a government perspective, we have to make sure this is legally absolutely accurate. So lawyers tend to spend a lot of time on everything that's produced to make sure it's absolutely correct. Like the researcher would say, I have to make sure the methods are absolutely kind of perfect, and I can't go outside kind of the box. And I think this is showing that if we could relax a bit, so could a Ministry of Labor actually see itself using some visuals like this to convey its message, that don't have all of, that haven't undergone the legal scrutiny and everything like that. Just as I now, as a researcher, am willing to kind of take many more risks and do things like this, which kind of from my very traditional quantitative training is very kind of out of the box. So it's not answering your headline question, but it's kind of, to me, saying from a practical perspective, it would be so nice to be able to kind of move to that kind of broader, more relaxed piece.
I couldn't agree more, Lynn. And it's Janet here. I'm thinking as well as I'm listening to Lynn. I completely agree with her, that idea of listening to people where they're at. And I was thinking in terms of that headline piece, something to do about reimagining occupational health and safety for new immigrant workers. Like I'm thinking of that reimagine in terms of how we might imagine things could be and what the potential is, but also that idea of image. The other thing, of course, which is a bit corny, but would be like a picture really is worth 1,000 words, might be the headline. But
yeah, I love that. I think both of what you shared, both of you, that was really meaningful, and thank you for letting me put you on the spot. I love that reimagining. So maybe just a last question here. Would you consider everything you're doing interprofessional? And if it's not really interprofessional, how could you have more or other professions working with you? I'm an occupational therapist. I'm an ergonomist as well. Are those some of the people that are working with you on this interprofessional team, or how can you bring them in?
So I'm a kind of an occupational medicine physician. Janet's background is
physiotherapy.
Janet Brown, kind of academic background is in business, and her other master's degree is in organizational development, which is quite different. We clearly had our artists. Chris, again.
She has a PhD in education where she used drawing in her PhD work with students at an arts college in the UK, but she also has an understanding of, she's also done work in cognitive psychology and artificial intelligence and human interaction with computers. So she has a really, really interesting background and is also a health services researcher. So she has a wealth of expertise as well. So, and I think also, as Lynn has said so eloquently, working with our community partners. But I think I agree with you, like interprofessionally, I think the rehabilitation sciences, occupational therapy for sure, and there's a whole host of professions, I think, that would find health professions and others, labor, law, who could work with us in this area, policy making, experts, people with expertise in government and public policy.
I've done a bit of work with a legal scholar, and that again was very interesting for me because it's a very different kind of approach to kind of academic pursuits. That certainly was very enriching. So I think your points. I think we were a fairly kind of multidisciplinary group, but I think there are lots of others that one could consider.
Yeah, thank you so much. Well, I think we are coming to the end of our time today. This was so exciting. I am so happy to have had this opportunity to be with you, and I want to turn this over to Tanya to conclude, because immediately following the webinar you're going to be directed to an evaluation survey to complete. So Tanya, I'm turning it over to you.
Great. Thank you very much, Karen, for your moderation and for your working together with us on these projects. We really enjoy having a relationship with Work Journal and doing these webinars. It's always really great. And then I'm also very thankful to Janet and Lynn for sharing your expertise and your experience and your research with us. It's been really great to have you guys on our webinar as well.